we should prepare everything to make the application quick and to be comfortable. The product goes in the vials that should be stored in the fridge. But please don't worry if you open or take out the box out of the fridge. It is stable for 72 hours for the room temperature. You should have the 3 ml syringe with the lure lock, which is better for you, just easier to use. The 18 gauge cannulas, which are supplied with the product, but if you don't have them, use normal 18 gauge pink needle. The rubber tip spatulas, this one might be used for the general application. I use this for a neck, as I do have big hands. This one I use for post-acne scars, box scars, rolling scars, chickenpox scars, and so on. This one I use for the necklines and stretch marks, the medium one. I always put the spatula in the nitrile glove finger because it's PVC, yes, and to make it reusable, to make it clean. It shouldn't be sterile, however, it is better when it's clean, so I use just a finger of my nitrile glove for the comfort, easiness, and to make it reusable. And I use the normal plaster to fix it a little bit, just for my comfort. The pea solution, moisturizing face cream for the dry skins, a bowl with the tap water, wipes to dry out the skin and to make the wet wipes with the tap water. 4x4s, as mentioned. I really like this word, 4x4s. And the last one, normal saline as an antidote if the product gets into the eye, is always in my pocket. First of all, I open the vial. It has the cap. See, secondly, I take the cannula, either needle, without an attached syringe. It is the gas inside, and if the syringe will be attached, it's gonna blow. So I take the lure lock syringe and draw 2 cc of the 2 ml of the product, which I'm going to use for our model. The vial has at least 4 cc, at least. So some of the customers say, there are objections of some customers that there is less, and they no, at least. I can show you this now, but I guess you believe. After we pull out the cannula, the stopper, the rubber stopper, blocks the air, and you can use it. It's stable after months, 10 days, expiry date, until the expiry date. However, from my experience, PRX-T never expires, never, believe me. It has a short shelf life, approximately 15 months. However, it never expired in my practice, and I never hold the half vial in the practice, because once you open it, you use it. So, we start our application. I don't use specific makeup removers. It's just, I'm showing you that with pea solution, within a minute, you cleans the skin without any specific ones. I dry the skin. The skin should be dry because we're gonna work with the acid.
Do you need to use Kleenex or you can use towel?
It's better to use paper tissues. because they do absorb best. Then for your comfort, for your training, I'm gonna paint you the zones which I am following by the application of the product. So I will apply it on the forehead. Yes. Then I followed the temples. Then I do zygomas with the mid-face. Orbital rim, as I mentioned. Then I do lower face with the chin as well here. Why do I block, or why do I do separate zone for the T-zone, so-called? Because this zone is the usual zone for the seborrheic dermatitis, and we're gonna apply the T-zone with one layer as well as lower and upper eyelid until the orbital rim, with one layer at the end of the treatment as the last zone. So here, this is for your comfort, to know and to understand what am I following, to which zones am I following. So very beautiful, very good. I don't need to put numbers in it, yes? So once again, I see that the skin is dry and my gloves are dry because I have used solutions, water and so on. I should be dry as well to apply the product. I take the syringe, always outside of the eyes direction, and firstly I'm going to show you how do I apply this with the spatula, with the rubber spatula. So you see I put a couple of drops of the product and do unidirectional moves until the product is absorbed. So if you do use cosmetic massage, Spanish massage, French massage, forget this, because this is the specific application technique, and here we don't need lymph drainage, here we don't need anything but the vectors of lifting and the product absorption. That's it. So don't do chaotic movements because you spread the product uneven. Don't do lymph drainage because you will receive frosting in the zone of lymph drainage. So I showed you how I did apply the first layer with the spatula. You see the skin is dry and a little sticky a little bit. If you feel this, do not absorb, because you will do the maceration of epidermis and the skin. So first layer done, I perform another drops, and you see manually I do it like this with the pressure 1.52 kilo.
So the first one you need to use the spatula and then...
No, it's just two different options of the application. You use that one that is comfortable to you. I just need to show you both, because some of the clients do not like when the doctor touch them, and some of them vice versa do like when touched by hands. So when I applied 3 layers, I'm gonna go to the temples. So I do like this. I put a couple of drops and do these movements with 2 hands. Of course, avoiding that the product gets into the eye. Our client may feel some slight burning or slight itching, which is manageable, and it's 3 out of a 5 or 5 out of the 10. Do you feel something? It is manageable or it is manageable?
You feel burning, right? That's what you feel?
Itching. So after the temples, I go to zygomas and the mid-face. And you see I'm following the lifting vectors of the skin, and I'm couple of millimeters above the nasolabial. You see, I don't start from the upper lip, I start a little bit above. If for the eyes, I do the orbital border, the orbital rim. If I only feel that it's becoming to be sticky, I do stop and apply another layer. You see, no rotating movements, no chaotic movements, just the lifting. Just imagine you are a surgeon and doing the facelift. What do? You do the traction to the lifting vectors. So just imagine, it will be make your process easier, make your application easier. So, how to feel? It was on the presentation. How to know that you applied correct amount of layers? Try the skin flap. You see, it's firm. It's still not firm here. Just imagine. Just have a look, and I will we compare after the application. I go to lower face and chin. Do you feel comfortable?
Mm-hmm.
Now you see, it's getting firm, but it's still not the end. I'm gonna get a little bit, just for my comfort. You see, the flap is very firm, skin fold. And the last thing, very quickly, nose. Close your lips firm, please. Thank you. Upper lip. You can basically do upper lip with this tiny spatula for barcode lines. Together with microneedling, it's a very good treatment. However, you should be quick, as this area is sensitive even by people who don't have, by clients who don't have seborrheic dermatitis. And just a tip for upper eyelids. Do you feel good?
So some people have dermatitis, seborrheic dermatitis around the nose only.
Yes.
So you can be everywhere, but avoid those.
You can try. You can try. Now, no exposition, wet wipes, just wet wipes with the water, and I'm removing the product, as it is absorbed. Close your firmly. Thank you. Just to, because the main thing is done. The product is absorbed. We have controlled this. Where do you have itching still? Tell us. Nose, eyes. No?
No.
So you see, she's even not pinkish, even not red. No itching anymore, or a little bit?
Maybe a little bit
Maybe a little bit in the eyes. So
on the side.
on the side here, yeah? Just once again, we're gonna double check to. So now we finishing the application. We apply Wyco moisturizing cream for dry skins, which we have in our practice, and clients should use it at home to restore the lipid barrier in between the treatments, together with Wyco fluid, which is used to stimulate additionally the skin at home. Here we might do the slight massage. This is the cream, so don't worry. It is better now? And the cream is a very good basic layer, so I just remove the greasiness. So, and the cream is also very good layer for Wyco ICP in invisible
Maybe this one.
color, invisible color protective. This is a 50 SPF. Tinted SPF.
You're also a makeup artist.
I'm a static doctor, so dermatologist. So I should know how to do this. It does has ultralight, light and medium color, which is, let's say, adjustable. Maybe I should listen to Christina to use darker color, the tone I mean, but you will see. But yeah, Christina is better than me, because she's from Italy, she's...
Yeah, it's in your blood.
So... You see, it's even. Nobody will understand this is a tinted foundation or something. And at least I also remove the greasiness and make the skin matte. You see?
it.
So now I understand that I was right as well. So you just look at you. Just look how beautiful you are. So now we have person number 2 after Alona in this room. Who is after the treatment. So treated with the peel that does not peel. Thank you very much. Thank you very much. If you do have any questions, please sit up. You can sit up.
Do you feel stiff, like tightness?
No, but I feel good. It does feel. Yeah.
Wow.
The cut before and after.
That's before and after.